This will be alarming to people right now, especially coming off the back of the Princess of Wales's revelation that she's being treated for cancer, because there's an assumption, you must see an assumption, that it's something that happens to older people.
Thanks for asking me on, Matt. So young onset cancer is still thankfully quite rare, and having a diagnosis like that at the moment must be terrible for anybody's family, and also for Kate and her family. Please be reassured, though, it is still relatively rare compared to older people, but we are seeing it increase in frequency.
What are the comparisons then? Because clearly the King has been diagnosed with cancer at 75, and we know that 1 in 2 people at some point in their lives will be affected by it. But what's the difference between getting cancer when you're older compared to when you are under 45, as the people are that you deal with?
What we tend to see is slightly more aggressive cancers that progress faster and are more resistant to treatment. And unfortunately, some of them don't always have the best prognosis. But because some of them are genetic as well, as you've just talked about, the likelihood is that they respond better to treatment. It's all in all quite worrying that we're seeing this rise, because people are having to have treatments that end up becoming very nasty, disfiguring. They can involve chemotherapy. And for patients who go through it, it's the last thing they need at a young age.
Yeah, and people will be watching, myself included, knowing someone related to someone who's probably going through this right now. So they will hear these stories about someone who's hugely in the public eye and responds around the world to this, and it will bring it back home to them. And they'll be thinking, well, what can I do? How can I help? How can I get ahead of this issue? What advice would you have for them?
I think the most important thing is for prevention is better than cure. So one of the problems is we don't always talk about some of the symptoms of cancer. Public health awareness is key to solving this. If you have symptoms, then go and see your GP. The government is very hot on this at the moment. Try and get examined. Don't dismiss them just because you're young. Young people get cancer too. And for instance, one of the cancers I deal with, Bowel Cancer UK, have a Never Too Young campaign. And so if you think you have symptoms, get it checked out, because usually if we get it quicker and earlier, just like the princess, then it's got a very good prognosis.
The other thing about prevention I know you've talked about is looking after your gut health. It seems that understanding gut health is something we're in the early days of, but you think there's something in that?
Yeah, I do. Cancer Research UK have funded a number of projects looking at the effect of the gut health on the risk of cancer. And certainly it's not quite as simple as good bacteria versus bad bacteria, but your gut health can have an effect on your likelihood of developing cancer. It can also affect the way you potentially respond to chemotherapy as well. So we do need to do more research on this to understand precisely what we need to do to improve cancer response rates and also rates of cancer.
Look, Andrew, the fact that you're a professor of this denotes that you have an awful lot of experience of dealing with cancer. During your experience, during your time of looking at this, how have things changed in terms of how we deal with cancer diagnoses?
It's changed a lot. When I first started as a doctor 20 years ago, just over 20 years ago, we didn't really talk about cancer in the same way. And when we talked to somebody about their diagnosis, they weren't always as well supported. But thanks to the work of patient charities and bigger charities like Macmillan, the way we talk to patients about cancer, more importantly, their children in young onset cancers, is vital. And it's important to have an open and honest discussion with everybody, but also tailor it to the person and tailor it to their family, because it's a very worrying time for everybody.
It is. The other thing people will undeniably think about at the moment is how the UK overall lags behind other countries when it comes to cancer survival rates. Recent reports have said we're 15 years behind the likes of Australia, Canada, Norway, other European countries in terms of dealing with cancer. I guess the tricky question is it too big a problem for the NHS to cope with these days?
Not really. I think one of the issues is around screening, and we need to make sure we target who we screen appropriately. So you've heard of breast cancer screening, bowel cancer screening, and they're great programs, and they really help reduce the risk. However, even when you do that, people won't participate. So bowel cancer screening, only 50 or 60% of people invited to participate actually take part. So one of the ways to improve our rates of bowel cancer screening participation is to get people in, get them taking the tests, and that should improve our rates. There are other problems as well regarding things like access to investigations and diagnostics, but that's still because we've got a massive backlog from the COVID pandemic, and it's going to take time to recover from that.
Yeah, look, final question to you, Andrew. I mean, you talk about screening. I remember talking a lot about cervical screening after the back of the death of Jade Goody from that, which had a huge impact on people screened for cervical cancer. Is there more that can be done there? What about prostate cancer? Because you hear about false flags with screening for prostate cancer, for example. So is that still a developing process in terms of screening more cancers sooner?
Well, it's very interesting, the debate around prostate cancer screening. PSA test, which we've all heard of, one of the problems with it is just not very accurate at telling you whether you have prostate cancer or not. So we get a lot of people who are told they have prostate cancer from PSA and don't. And on the converse, a lot of people who do have prostate cancer have a normal PSA. So we need to find better screening tests, things like prostate cancer. We're sort of there with bowel cancer and we're there with breast cancer, but the other cancers need better screening tests in order to reduce the mortality.
Professor Andrew Beggs from the University of Birmingham, really appreciate you joining us here on Sky News this lunchtime. Thanks so much.
Thanks for having me, Matt.